Good morning and happy Tuesday, everyone. I hope this video finds you well. Welcome to another episode of our Oral Pathology Corner series within the overall Tooth Teacher Tuesday series. Today, gonna actually divert a little bit away from oral pathology and talk about something a little bit different. From time to time in this series, I've talked about things outside of the mouth, things that, how your overall health connects to your oral health and vice versa. And today is one of those topics because, as dentists, we are doctors and certainly our area of expertise is the mouth. But in our training, we are trained to at least screen for and be able to recognize some of the common symptoms of other overall systemic health conditions. And that's what I'd like to talk about today, is one such thing that's pretty commonly found in our routine dental screenings, and that is calcifications in the carotid arteries, which are some of the main arteries that run through your neck. You ever think of checking your pulse? If you're somebody who's into fitness, you're checking your carotid arteries there. And the way this comes up in dentistry is, we've previously talked about different types of x-rays and how one such x-ray is the panoramic x-ray, the big x-ray that goes around your head that we recommend getting every 3 to 5 years or so on a person-to-person basis. And those x-rays show us a lot of things. Obviously they show us the teeth and jaws and, the things that are our primary focus, our area of expertise as dentists. But it also allows us to visualize other things like the sinuses and also kind of the upper part of the neck. And that's where calcified carotid arteries come in, is that sometimes on these panoramic x-rays down along the neck, we'll see these little kind of white speckles in the neck. And what those speckles typically are little areas where the carotid arteries have calcified plaques of bad cholesterol that have accumulated and are large enough to show up on these x-rays. They would look something, a lot of variability, but they would look something more or less like this. And again, certainly anything outside of oral health is not anything that we as dentists are qualified to treat or officially diagnose, but we are trained to screen for things like this and recognize, okay, something's not right here. And that's where anytime I see these calcified areas in the neck, I tell my patients, look, don't want you to panic for any reason, but I am seeing something out of the ordinary here. This is what I suspect it is. And I'd really like you to follow up with your primary care physician, or if they have a cardiologist already, follow up with them and just let them know that I had this concern. And I'll even send a copy of that x-ray with the patient to show them, because that's certainly something to not mess around with. Any kind of plaque along the walls of arteries is not a good thing. That's going to tend to block blood flow, and that's how we can end up with things like a heart attack, or in this case, since the carotid carries blood up to your head, obstructed carotid arteries could possibly lead to a stroke and, not getting enough blood to your brain. And especially if those plaques have been calcified, that they show up on the x-rays, that tells us, kind of like the buildup in your mouth, if it's starting to calcify, it's been there for a while. And so if that truly is what it appears to be, we want to do something about that, because as much as oral health is important, anything we can to avoid a stroke is even more crucial. And that's, basically all there is to it on the dental side of things, beyond just making patients aware that something appears to not be correct and to get to the proper doctors who can properly diagnose and treat that, which, depending on the severity, if that truly is calcified plaque in the carotid arteries, is usually going to involve being put on some kind of cholesterol medication, or maybe if it's severe enough, going in there and performing some procedure to clear up that blockage. So again, like I said, not hardly our area of expertise as dentists, but I do like to touch on these kind of things that do connect to what we as dentists see on a day-to-day basis. And so hope you found this information useful, and again, if you were to ever have this pointed out to you by your dentist, certainly not any reason to panic, but also something to take seriously so that you can avoid having any health complications in the future. So thank you for tuning in. As always, I appreciate the pleasure of your time, and I hope you will tune in to next week's episode of Tooth Teacher Tuesday. Enjoy your week.